What the Minister of Health has done in this country is very commendable, and the country seems like we are moving forward now because the minister has done something that many people did not expect. The Minister of Health went to Bayer Hospital where she went undercover to see how patients are getting treated there, and also to find out herself like how professionals are working at the hospital, and she has discovered that many things are happening at the hospital which are not very good, because as a country we cannot be grouping patients and beginning to ask them questions. It is very important that we should respect privacy, and the minister is doing this, even helping Malawi to understand that she is working very hard to make sure that everybody else in the departments that are working in health services are doing their good job to make sure that the country is moving forward in terms of development, because that's what Malawians are waiting to see. So we need to say here that the minister is doing something very important. This is going to encourage the people who are working at the hospitals to begin to love their work, in the sense that they should be doing things in other way, because if they just do everything anyhow, what happens is that now the job becomes dissatisfactory and they cannot work very hard, because always they are doing things in the shortcut, and this is boring because it's like there is no passion at all in you. So the minister, indeed, I should say here that she did that wisely, and this is going to help in this country to make sure that maybe people must be doing the things that Malawians are expecting them to be doing, because as Malawians we need to see that the hospitals are doing things in a very high standard way, so that the Malawians can be receiving treatment that is equal to other countries, like where maybe our presidency are always going to receive the treatments, and the ministers, they go to outside the countries to receive the treatments, and they know how they're getting treated there. Now here in Malawi back home, we are not receiving the same treatment, but we are being looked at as bad people, and the patients are being insulted by the nurses and doctors, and this is not good at all. In fact, what we need to do is to make sure that our hospitals are giving Malawians high standard treatment, better treatment, so that the Malawians can feel better. You know, whenever you're just receiving this best, it helps you to get morale, and in fact, even if there is a disease, but because of the type of the treatment you are receiving, that can just even kill the whole disease in you, because you are encouraged, you're motivated, and this is a very good thing to do. In fact, the minister, I believe like that she's going to do more, not only just to stop what she has started doing, but pushing it up so that the Malawians can be receiving the best indeed. And this should only not just happen in the Ministry of Health, but we would like to see all departments in this country, all ministries, others to be doing the same, to make sure that people out there are working very well professionally, so that Malawians can be receiving the best treatment in this country. We really need to do some more things in our country, so that we can at least move out of this poverty trouble that has been in our country for a long period of time, because of the way we are doing our things, the actions, the behavior. We don't seem to change. Actually, I also am for the thing of the mindset change. That is very important thing to do, because if we can transform the whole public sector, then Malawi is going to be transformed greatly. But it seems like Malawians, we are resisting the public sector reform, because I don't understand it. Maybe some people are benefiting out of the mess that we have in this country, because it seems like many departments in this country are not working very well. And I'm hearing about the companies that are making losses, which was, of course, for me, it's a big surprise, because we're not supposed to be making losses, because there are big companies and actually they are deserve to be making a lot of billions in this country, but now they're making losses, and it's very bad that we're hearing them asking for the help from the government. Yet these companies, they operate like they are companies that are profit oriented, but hearing about the losses they are making, it's very discouraging in this country. So here we're talking about the issue that the Minister of Health has done, whereby she went to Boila Health Center. Is a hospital there where she went as a patient, and she went there in the name of Mercy Banda, just a pseudonym. And what we're hearing that there she was received by the security man, and the way the security man greeted the minister was not even that professional. A lot of things are happening in this country. Actually, we need to change the way we're doing our things. It's not only about security, but it's the whole thing in Malawi. We must do what we call ad hoc transformation, radical change. We need to do things like in the way that we need to see the change happen in this country, transforming things, reforming things, bring the nation back to its best position whereby things can be being done in a way that we need to make sure that Malawians are receiving the best. Very surprising in our country whereby a Malawian you might be receiving the treatment which is low standard, and somebody who is not Malawian but maybe is coming from America, Canada, is coming in Malawi and receiving the treatment, but because of the skin tone, you find out that the person who is from outside the country receiving the best treatment in the same hospitals whereby Malawians are getting the treatments, but they're getting poor treatment. And this is not good at all. Let's make sure that we are loving Malawians and doing our things out of passion, not just doing things randomly, thinking like we are better when we are doing the bad thing to the country. So what we are saying is the country is passing through a lot and economically, but the minister is doing very well, and this can help this country to develop if we keep on doing what the minister is doing. Thank you for watching this video. I'll come back with another video. Subscribe, like, comment to my video, until I come back with another video. Bye bye.